please come on in. Of course. Well, we're really happy to see you at our clinic. How are you doing? You are here for your cranial nerve exam, is that right? Wonderful. Okay, well, may I ask you a few questions before we start the actual cranial nerve exam? Yeah, like usually before any kind of medical examination, we would ask our patients about the way they've been feeling lately, their complaints, some symptoms, if they have had any, stuff like that. So, just one thing I was about to tell you, please don't hesitate to ask me anything or tell me anything. There are no stupid or silly questions when it comes to your health. So please don't be embarrassed, that's totally fine. It's unlikely that you will surprise me or shock me in some way. I'm an experienced doctor, so that's totally fine. Please don't worry about that. So, once again, have you had any certain complaints, or is it just a regular checkup for you? I'll be typing in some information while you're talking, so I hope that's not a problem for you, right? It's just so that we don't miss anything. Sometimes it can be really challenging to keep everything in mind, my memory, and especially taking into account that we usually have quite many patients every single day. So yeah, it's really better if I just take some notes in the process. I hope that you don't find the sound of keyboard typing annoying or something. Good. Wonderful. Thank you for your understanding. Okay, so please keep on talking. How long has it been? Yeah, how long have you been experiencing these symptoms? Yeah, I can see that. Right, that's alright. It's really good that actually as soon as you feel that something is wrong, you make an appointment with the doctor right away. It doesn't really make sense to lose your precious time. Right. Yes. No, sure, please. Keep going. It's totally understandable. What about your nose, mouth and throat, your ears? Have you had any symptoms like something related to ENT? Have you had any colds lately? Colds or something like flu, any kind of viral infections? Any bacterial infections that you would know of? Oh, absolutely. Right. Yeah, it all can impact the way your senses work. Like, for example, there are known cases when people would partially lose their sense of smell for some time, like usually temporarily, of course, but still after some viral infections, so just happens. Sometimes it can even alter your sense of taste and stuff, so yeah, it can work in different ways. It's very individual for everyone, but yeah, it's just good to know, right? Have you been in any accidents lately? Any injuries, like your head, neck, any other parts of your body? Yeah, you've got to be careful. Okay. Oh, that's perfect. Yeah, thanks for actually being so detailed in that one. I appreciate it. You know, sometimes it can be really hard when you're trying to ask for some information, but patients are very reluctant to talk, and yeah, it's just hard to understand what exactly is bothering them and stuff. So, yeah, the more descriptive you are, the better. Okay. Wonderful. Well, I guess that all the rest we will actually find out in the process, okay? That's perfect. Yeah. Right. So you know what? I just have a few more questions. Could you please confirm your phone number for us? Okay. Your home address, is it the same as it used to be? Ooh. Yeah, moving to new places is really cool. It can be sometimes a real pain in the ass though, but yeah. I mean, okay. Yeah, there might be a lot of challenges related to that, but it's still cool. How do you like it there? Okay. Wonderful. Okay, well, I guess that would be it. Now, of course, I remember your name and your last name. Sure, we have it all in this system right there. Well, do you have any questions regarding the whole procedure? How we're gonna do everything? I will tell you as much information as I can in the process so that you know what I'm doing and stuff. Okay? I don't want to scare you. Okay, so the cranial nerve exam usually involves different stages, different parts, because we are supposed to check the way your cranial nerves work, and you actually have 12 pairs of them. I've had the picture somewhere. Let me just try to find it. Okay, I've got so many charts, like medical ones and stuff. Oh, okay, maybe this one will do. Okay, good. So here you can see that they are all connected to your brain, and then I suppose that today we might start with the olfactory. Okay. It's usually a lot of fun. No one has complained yet. So, olfactory means that we're gonna check your sense of smell. But before we do that, I'd like to have a closer look at your nose if you don't mind, okay? That would make sense, I guess. Have you had any nasal congestion lately? Could you turn your up a little bit? Well, I don't see anything disastrous in your nose, but let's just check it. Check your respiration, your breathing. That's the most effective way to check if you have any kind of nasal congestion or not. Because you know, sometimes there are some patients who actually need some kinds of septoplasty, because the reason might be not a cold or something like that, some like viral infection, but it can actually be just their internal structure, the way their nose is built, and sometimes this septum, yeah, that basically divides the space between the two nostrils. Yeah, I'm just trying to explain it in simple words. So sometimes that can be the reason, the way it is like located inside your nose, and in such cases a little surgery might be actually necessary. So I hope that it's not your case. Let's just check if it works. So in order to check if there is like a stream of air and if it can pass through your nostrils, both of them equally well, I'm gonna take a little piece of cotton, or sometimes it can be also a really thin brush, something like this for example. And what I'm gonna do is to actually put it close to your nose, and then I'll ask you to close one of your nostrils and take a breath. And so when you breathe in and breathe out, we'll see how well they can actually move. It can also be a really thin piece of paper, doesn't matter. So thus we'll be able to check if you have this stream of air passing without any obstacles through your nose. So just try to relax, that's alright. Please close one of your nostrils and please take a deep breath in and breathe out. Okay, perfect. I could see it move, that's alright. Now with the other one, just exactly the same kind of thing. Breathe in and breathe out. Wonderful. You're actually doing good. Okay, so your nose seems to be just fine. Now let's check how functional it is. If you can actually feel all possible smells and scents and stuff like that. So today we're gonna use some cotton swabs for that, some Q-tips, whatever you call them. Okay, I'll take one and I'll spray some scent onto it. Yeah, sometimes we can have this like liquid, the actual bottles, so sometimes we would just dip the cotton swab into that and let you smell it. Sometimes we can do it directly from this like tiny bottle. It might be even more convenient. Today I have some in spray form. Okay, I just put some onto this cotton swab. Don't worry, that's more than enough. So now you're definitely gonna be able to actually tell me what smell it is to distinguish between them. So just please take a smell. Don't hurry, that's alright. There's no rush. Take all the time you need. Let's try again. If you're still doubting, like hesitated, you can hold it. Take it. That's alright. So just take a sniff once again. Give it a smell and tell me what you think it is. Thank you. So, cherry. Okay. Well, cherry it is. Okay, good. Now, I'm a huge fan of cherries, especially this sour one, like tart cherry that you put in the cake and stuff. Yeah, I love sweet ones too. They're fine. Okay, wonderful. Now let's skip to the next one. Okay, let me take just another cotton swab. Okay, good. So again, let me some spray into that. I want to make sure that it's more than enough for you to actually be able to feel it. So, you're ready? Shall I hold it for you, or would you like to take it in your hand? That's fine, I can assist you with that. So, what's your verdict on this one? Okay. strawberry, you sure? Just kidding. Absolutely, you're right. Tease strawberry. Okay, wonderful. Let's try another one, okay? Seems like you're having a lot of fun with it. Would you like to choose take the cotton swab on your own? That's alright. You can pick one. I mean, they're all the same technically, but okay, perfect. Now hold it for me. I'll just put some spray onto it. Thanks for your help. Okay, so now give it a smell. What do you think it smells like? What kind of scent is it? This might be, yeah, there might be some standard ones, some more exotic ones, I don't know. You choose. What do you think it smells like? Pineapple. Right, you are. Good. Right. What's your favorite fruit, by the way? Okay. Well. Now, pick one more. Okay. Good. And now let's maybe put some spray into that. Oh, that will do. So, you got any idea of what it could be? Okay, you're close. Grapes, right, yeah. Wonderful. Okay, now your sense of taste. Let me have a look at your mouth for a moment, okay? Could you please open it and say ah? Okay, good. It's alright. I will use a spatula for a moment, and also I'll check right away how your tongue is working, because there are some nerves which are responsible for your tongue movements, stuff, for your sense of taste, of course. So give me a second. Put it in. Okay, could you please try to move your tongue to the side? With the spatula in. Okay, now to the other side. I'll take it out, and please try to move your tongue once again to reach the inside of your cheek with the tip of your tongue. Yeah, I mean, it might look a little weird when you do that, but in such way I can actually see if everything is working just fine. No worries, that's alright. Now let me have a look at your throat. Okay, I don't see any redness or swelling or anything. Nothing alarming. Good. Well, now let me have a closer look at your thyroid as well. Cheeks. Okay. No, good. Everything is just alright. Have you had any issues with your hormones? Okay. That's all right. Okay. Well, now your sense of taste. Let's get to it. Okay. I have different kinds of testers, flavors to check it. I will drop a little amount of this liquid onto your tongue. Okay. Wonderful. You ready? Okay, great. So stick out your tongue, but just a little bit. That will do. That's fine. Okay, great. I think that will do. Give it some time. Take your time. Don't rush. Just try to, feel it. Keep it on your tongue for some time. Yeah. You don't need to swallow it right away. So what you say, what does it taste like to you? Okay. You're sure? So you can feel that combination of taste? Are you sure? So you can feel some kind of raspberry, but also some vanilla notes to it. Ooh, good job. You're absolutely right. That was a challenging one for the most proficient patients, and you nailed it. Good. Okay, let's try another one. Again, it might be some mono flavor. There can be also a combination, some kind of duo. Let's see how well you can actually feel it. So you're ready? Okay. There is also a glass of water next to you. So whenever you feel like you feel thirsty or that you feel to, rinse kind of like your mouth after some flavors, that's alright. Please help yourself to it. So, what do you think it is? Wow. So you're saying that it tastes like coconut and banana mixed together. Right, you are. Good job. Okay, one more. Okay, let's do it. Okay, ready? So, what do you think it is? Take your time. There's no rush. Okay, so you can feel some citrusy flavor and some fresh mint. Well, right, yeah. It's actually lemon with peppermint. Good job. You are doing amazing. Seriously. Okay, well, just give me a moment, okay? I have to put your outstanding results in the system. Okay, well, are you ready to proceed? Once again, do you like some more water? Shall I refill your glass? Okay, please don't hesitate to ask for a refill, okay? Just let me know whenever you feel like you need it, okay? Wonderful. Good. So, now, the next thing we're gonna check is your sensation in your face expressions and movements. So we're gonna check your facial nerve and basically, yeah. So, you ready? Let's do it. Could you please frown at me? Good job. Now, could you please act all surprised and raise your eyebrows as if you're really, really astonished? Good, wonderful. So, then could you please shrug your shoulders? Okay, perfect. Good. Now could you please shrug them and keep them up for a moment? I will try to put them down. Don't let me do that. Try to resist me. As much as you can. Okay. Good. Now, please puff your cheeks for me. Like that. Exactly. Now, please puff them again and don't let me close them. Yeah, it's a little bit funny, but still, you did it just right. Good. Now, could you please give me the widest smile possible? Oh, that looks beautiful. Good. Okay. Now, please try to clench your jaws. Good. And I will try to pull your chin down, kind of like to unclench them. Don't let me do that, okay? Okay, wonderful. Now, please just clench your face like that. Once again, I will try to open it. Don't let me do that. Keep them this way. Yeah. Okay, wonderful. And the other hand. Great. Just try to resist me as much as you can. Wonderful. Good. Okay. Now, please just try to move your head this way to one side as if you're trying to reach your shoulder with your chin, like that. Good job. Now to the other side. Wonderful. Okay, now please try to put it down like that, trying to reach your shoulder with your ear. And now to the other one. Okay, wonderful. Great. Now please try to once again put your arms, your hands this way. I will try to pull them down. Don't let me do that. Keep them this way strongly on such level. Okay. And now the same kind of thing, but I will try to push them up. Don't let me do that either. Wonderful. Good. Give me a high five. And with your other hand. Perfect. Good. Now could you please close your eyes and reach your nose, the tip of your nose, with your pointing finger. Okay? Just like that. Straighten both of your arms. Just do that. You can do it. If I can do it, then you can do it too. And then with your other hand, please. Okay, perfect. Good job. Now, could you try to stand on one leg and do the same kind of thing? It's fine, no worries about that. In case something goes wrong, it's alright. I'll catch you, yeah. Okay. Yeah, I won't let you fall down. No worries about that. Just close your eyes. Okay, wonderful. And now the same kind of thing, but standing on the other leg. Yeah, it's a bit similar to this sobriety check and the police stops you. Okay, so you ready? Good. Now you can sit down again. Your balance seems to be just fine. Now, please let me check your reflexes. For that purpose, I have this percussion hammer that matches my nails just perfectly. Okay, just kidding. I mean, it does, but that's not the big deal. Well, so what I was about to say, I'm gonna check your nature reflex and also some other tendons with this percussion hammer. Please don't worry, it's not gonna hit you painfully or something. You're not gonna feel any kind of discomfort, alright? I'm not gonna harm you in any way. So just relax and please put one leg over the other like that, bend in their knees. Good. Now could you please switch them? Okay. Perfect, wonderful. Now can I have a look at your wrist? Now the other one. Wonderful. Good. Your elbows as well. Great. Well, actually. Would you please have a look at this percussion hammer for a moment? Could you follow it with your eyes only? It's very bright, so it's really easy to kind of concentrate on it. Okay, great. I'll do some more tests like that with the light and with my hands as well, so don't worry about that. Okay, good. So just let me break it down, okay? Okay. Okay, now I'm gonna listen to your heart and also to your lungs. Let's see if they're working just fine. Okay? That's perfect. Yeah. Okay, you're ready. Could you please pull your shirt up just a little? That will do. Also, this thing might be a little cold. Sorry about that. There's nothing I can do. Just relax. Is it too cold? Maybe now it will be a little bit warmer. Okay, once again. Just breathe in, breathe out. Good. Now once again, breathe in. Breathe out. Wonderful. Now once again, breathe in. And you can breathe out. Okay, wonderful. Now once again, breathe in. Could you please turn around? Once again, breathe in. Hold there for a moment. You can breathe out, thank you. Once again, breathe in. Hold there for a moment. Breathe out. Amazing. And one more time, please. Breathe out. Good. Now, let me listen to your heartbeat for a moment, okay? Good. Your heart is just fine. Wonderful. And your lungs too. I haven't heard any peculiar noises in your lungs or something, so it doesn't seem like you have any kind of bronchitis or pneumonia, something like that. So. Good. Oh, that's really great. have any questions? Are you sure that you don't? It's okay even if you do. Like I told you many times, it's totally fine. You can ask me anything related to your health, at least. Not sure about personal questions, but okay. Good. That's alright. Okay. I was actually thinking of taking your temperature as well. So if you don't mind, just in case, since you described some symptoms that you've had before, so just to be on the safe side, you know. Do you prefer it in your mouth? I know some people would rather put it in their armpit or stuff. That's no, we actually have disposable ones. It's alright. Don't worry, it hasn't been in anybody else's mouth. That's alright. Yeah, those other kinds of thermometers that good. What was I saying? That there are these other kinds that you simply put close to somebody's forehead and it shows you the instant temperature. They are not particularly accurate, not the most precise ones. I mean, they can be good if you simply need to see if the person actually has a fever or not, but they're not very precise, so. But good, you're alright, just fine. Wonderful, so now we don't need to worry about that. Okay, now there are some more things left to check. In particular, these are your hearing and your eyesight. Usually, patients really love this, I guess, detailed tests like that. Very detailed eye exams, very detailed ear exams, hearing tests. So today we're not gonna actually pay too much attention to them. I mean, what I mean is that we're gonna actually check them, but for more thorough, for more detailed check, you can actually make an appointment, you know, for your hearing test separately, and then for your eye, like vision check and stuff. Okay? Deal. Well, that's wonderful. So, your hearing. Let's start with that. I know that most of our patients really enjoy this snapping test. So let's give it a try, give it a shot. Please let me know how many snapping sounds you can hear. Okay? Okay, great. Just try to relax. It's alright. No need to try to concentrate too hard. Okay? Good. Four. Good job. Okay. Let's try one more. Just 3 of them. Okay. What about now? 2. Okay. Have you heard 5 or 6? Okay. Yeah, the last one was too quiet. Okay, good. Now please let me know which side the snippet sounds do you think are on, if they're closer to your left ear, they're closer to your right ear, just let me know, okay? Or maybe both equally. Okay, right jaw. Good. Good, you're right, okay. So, what do you say? Okay. What about now? Okay, good job. Okay, great. Good. So we also have different kinds of peep tests. Tests with tuning forks, some other kind of sounds when you have to guess what sound you think it is and stuff. But we're actually gonna do them at your like designated hearing test. And tonight we'll do a short whispering test and skip to your eye exam. Okay? How does that sound? Good. So, you're ready. Pomegranate. You just have to repeat what you've heard. Good. Cherry tree. Good. The Shining. Yeah, I'm currently reading it. Okay. Good. Now, lip gloss. Stethoscope. Okay. Apricot blossom. I especially like the ones which are pink, give like this pink shade of flowers while they're in bloom. Oh, looks amazing. Okay. Good. Croissant. What's your favorite kind of pastry? I love croissants. I actually like the ones you can simply eat with butter with no filling, no stuffing, but lately, like recently, I've been to a really nice coffee shop and they serve these really, really amazing croissants filled with milk chocolate, and there's so much filling, so much stuffing inside that it's not like croissant with chocolate, but more like chocolate with croissant, you know. Well, actually, it's kind of like a guilty pleasure because, you know, too much sugar is never good for you, so. But as a doctor, I must admit, yeah, those things are really, really good, really delicious. So from time to time, yeah, we can indulge ourselves a little bit. Okay, good. So with whispering test, everything seems to be just fine. You could hear everything. So that's really good. for me. Now look down to the right and to the left. Good. Now with your other eye, the same kind of stuff. Look up and look down to the left and to the right. Good. Now, could you please follow the light for me? Keep on following. Good job. Just trace it with your eyes, but don't move your head. Good job. Okay. Now look at my nose. Please tell me when the light appears somewhere in your film. Good. Wonderful. Okay, listen. Good. Well, you're actually doing great. Now, please keep on looking at my nose and tell me when you see my fingers wiggle on either side. Good. Good. Okay. Awesome. Both sides. Wonderful. Okay. Amazing. Now, please, okay, close one of your eyes with your hand and tell me when the light leaves your field of vision. Keep on closing it. Let me help you a little. Okay, let's do it. So it's gone now. Okay, now let me help you with the other one. So it's gone. Okay. It basically makes sense. What color is the tip of the percussion hammer? Tell me, please. Okay. What color is stethoscope? Okay, good. What color is this brush? Okay. What about this brush? Good. What about the tip of this wooden stick? Good job. Okay, great. Now what about this brush? What color do you think it is? I'll actually bring it a little bit closer to you so that you can see it. And what about the handle? Good. Oh, I have plenty of special plates and cards for you, but that's alright. Now let's have a look at these letters. So what color are these? This line? Good. What about these? Okay, fine. What about this line? And what about these? Can you actually see difference between these three? They're all a little bit different shades of color. How would you describe them? Okay, what about this one? Good. What about these? Okay, and finally, this one on top. Good job. Okay, that's great. Now you're not colorblind. Once again, we'll have plenty of tests like this, but at your specialized eye exam, right? Yeah, it's like a little bit of a teaser. Like a trailer to the movie. Okay. Let's test your vision acuity in a little bit more detail, okay? So, let me just take the Snellen chart. So please tell me, what is the lowest and the smallest line that you can still read? Let's give it a try, please. Okay. Good job. Wonderful. And now could you please read the line below? There might be some mistakes, but that's all right. Don't worry about that. You're doing just great. Good job. Thank you. Wow. You did pretty good. So, I don't see any troubles with anything, like at all. So you're perfectly healthy. I might just give you a few general recommendations regarding your diet and your sleep, of course. So how many hours of sleep do you usually have daily? Well, sounds like you could do better. Right. I think that's, yeah, at least 7-8 hours is pretty good. And it's less than that. It's not enough time for your body to fully recover after a long, hard day, okay? Good. Okay. Now, regarding your diet, like we discussed before, some guilty pleasures from time to time can be cool. Just please make sure that they like all these kinds of food which is not particularly healthy, that it doesn't take more than 20% of your general diet, okay? So usually the doctors recommend that 80% of your food, of your diet is healthy, like some whole meals, and then the rest 20, yeah, can be some occasional sweets or some kind of fast food, junk food that you kind of enjoy. But yeah, it's of course better to minimize it. Do you do the cooking on your own? Yeah, you know, once you learn what works best for you, it's not actually that time consuming, right? Yeah, cooking can be fun for sure. Okay, great. Well, now a few more things. So, it's really great that you take such regular checkups. We'll be waiting for you for your hearing test and your eye exam. Sometimes we can also have these extremely detailed sense of smell checks and sense of taste. It can be lots of fun, believe me. Don't skip that. Yeah, you did extremely well today. Okay, wonderful. Well, and then of course you remember, just take good care of your health, of yourself, and make sure to make an appointment with the doctor in case you feel something is wrong. Okay? Great. Well, once again, thank you. And I'm gonna see you pretty soon. Have a good one.